All right, guys, let's go ahead and get started with the meat of our presentation. And what I first wanted to start with was going over some childhood chronic diseases that I see a lot of, and that's asthma, allergies, and ear infections. And these things are definitely on the rise due to the stress that kids have on them nowadays, due to bad diet. Also, too, there's going to be things like birth trauma and chemical stress and a lot of things that will create chronic diseases in our kids. But let's go ahead and go through and talk about what these actually are. So let's start with asthma. So what is asthma? Asthma is a chronic long-term illness which airways become blocked and narrowed. This is usually temporary, but it causes shortness of breath, trouble breathing, other symptoms. If asthma becomes severe, the person may need emergency treatment to restore normal breathing. So for any of you guys that have ever experienced an asthma attack, it's pretty scary, especially when it's your kiddo, because you feel absolutely helpless. And it's something that we help a ton of kids with, and it's something that's pretty serious. Now, what actually happens here? Well, the process happens like this. The body comes in contact with what we call a trigger. Once the body gets triggered, the bronchi and bronchioles, they become inflamed. At the same time, the muscles on the outside will start to tighten up and constrict. This causes the airway to narrow. Then fluid that's in the airways gets released into the bronchioles, which also becomes swollen. The breathing passageways become narrow and makes breathing super, super difficult. Good luck trying to get air through there. Really serious, really scary, and it's something that a lot of kids suffer with. And what really triggers this attack? Well, let's talk about that. Symptoms of asthma are triggered by things like from the environment, obviously. These are going to be things like cold air, exercise, allergens is the biggest thing, okay, such as dust mites, mold, pollen, animal dander, cockroach debris, and several types of viral infections can cause asthma as well. The biggest thing that we see is mostly allergens, and it's mostly due to physical activity. Exercising will cause asthma. But the thing with asthma is it's a chronic childhood disease that holds a lot of our kids back from being able to participate in sports, to be able to play and just be a kid. And it's something that's very easily treated, which we'll get into later on in this presentation. But first, I thought let's actually go through and talk about what these things are. Okay, some of the signs and symptoms are frequent coughing spells, which may occur during play, at night, or while laughing. Less energy during play, because obviously if you have a kid that has asthma, they're not going to have a lot of energy because they can't get oxygen. Whistling sound, wheezing when they're breathing. Complain of chest tightness or chest hurting. This is mostly going to be during physical activity. So if you have a kid that is experiencing these symptoms, that's going to be your asthma. Okay? Let's go ahead and get into what allergies actually are. Allergies are hypersensitivity to an immune reaction to a non-harmful substance. So immune reaction to a non-harmful substance. So basically, kids with allergies, their immune systems aren't working too well. Here's the process. An allergen enters the body through the skin, lungs, or bloodstream. The body recognizes the allergen as an invader and sends antibodies to attack. These antibodies are white blood cells release histamine to stimulate the bodies to get rid of the allergen. This is when your child might present with a runny nose, sneezing, watering eyes, and rashes are a big one in kids. That's just another way of their immune system trying to push an allergen out. And the thing here is, remember, most allergy medication that we take is antihistamine. So it's blocking the body's ability to naturally get rid of that allergen. And I want you to think about every time you give your kid an antihistamine, are you actually helping them or are you hurting them in the long run? Their body's trying to get rid of the allergen, but at the same time, you're getting rid of that process by giving them an antihistamine. So this is the process of allergies and why it's maybe not always smart to be giving kids antihistamines all the time when their body's trying to naturally get rid of it. But it's something that plagues a lot of our kids. Let's go through the signs and symptoms of allergen. Skin rash or hives, like we just talked about, coughing, sneezing, itchy eyes, dark circles underneath the eyes, runny nose, and trouble breathing. Allergies are a big part of what we see here at Rose Chiropractic and Wellness, and the key with allergies is it always happens to kiddos whose immune system is not functioning at 100%. you help stimulate the immune system, you can get rid of a lot of these allergies. Okay, let's go on to our next one here, ear infections. Ear infections are a big one. The medical term for these are otitis media, which means it's an ear infection in the middle ear, which is behind the eardrum. It's the most common childhood illness treated by pediatricians. 75% of all kids have at least one middle ear infection by the age of 3. This is a big one. The majority of pediatricians, this is what they're seeing are ear infections. And this is what we see a lot of in my office too. Now, what happens with an ear infection is it's actually fluid that gets built up behind the eardrum in the middle ear. Now, this eustachian tube, that's supposed to be there to drain. Why would fluid get built up there? Well, it's because the tube is being closed. So how does this actually happen? Well, there's this muscle called the tensor valli palatini muscle, which is innervated by a nerve coming off the mandibular nerve. Its actions are to help us chew and keep open the eustachian tube. When the TVP muscle does not get the correct nerve flow, it begins to malfunction and close the tube. So this muscle is just like any other muscle. If it doesn't get the correct nerve supply, it's going to spasm and it's going to get tight. And for kids that don't have the correct nerve supply going to that muscle, it's going to close the tube. When the tube closes up, guess what happens? Fluid builds up and you get that swamp in their ear. Okay, so fluid builds up, it gets infected, there's your ear infection. Whoop, let me pull that up real quick. Whoops, excuse me. There we go. Okay, so what are the signs and symptoms of an ear infection? Well, they always occur first with cold-like symptoms. So sniffles, fluid coming out of the nose, nasal stuffiness, congestion. As it starts to get infected, you'll see thicker yellowish mucus. Some kids will have a low-grade fever. Sore throat is common, and they may have a cough. But here's the thing. Ear infections always start with symptoms of a cold. Okay? This is a big one as well. We help tons of kids with ear infections. Remember, it's not due to just random fluid getting infected. It's actually due to that eustachian tube not being open. Okay? You have to keep the muscle working correctly to keep the tube open. Once that happens, your kids don't get ear infections because that fluid will drain like it should. Let's go ahead and stop right there and open up for discussion, and we'll go from there.